is one of the most precious of the five senses, and there are a lot of things you can do to keep your eyes healthy so you can see your best.
That's right, and Dr. Jeffrey Gold is a board-certified ophthalmologist as well as a medical director at Liberty Vision and is here to put our vision knowledge to the test, Teresa. I hope you're up studying late last night.
Dr. Gold, we're going to do a quiz here?
Quiz, yeah, just like in school.
Not too.
Well,
I've talked to you enough times. I might be okay here with the questions. But what do you have for us?
All right, let's start with, on average, this is true and false.
Okay.
On average, a person blinks about 5 times per minute. True or false?
False.
False. It's more like 12 to 16 times per minute.
Okay, that's 1 point for each of us.
Okay.
Right.
Cool.
Next question. Newborns don't produce tears.
Oh, I don't know.
False. They cry a lot.
They make crying sounds, but they don't produce crying tears. The reflex that allows tears to spill over doesn't start till about somewhere between 4 and 13 weeks of age.
Wow.
That's a point for me.
Little fun fact for Teresa.
Yeah.
Okay.
Next question. The muscles that control your eyes are the most active out of all the muscles in your body.
I'm going to say true.
True. They even act when you sleep. You've heard of rapid eye movement?
Yeah.
Oh, sure.
Yeah. Next question. 80% of vision problems worldwide are avoidable or even curable. True or false?
True.
False?
True.
Oh.
It's true. And the most common disease around the world is cataracts. And the most commonly occurring operation around the world is cataract surgery. Next question. Smoking does not affect your vision in the short or the long term. True or false?
Oh, it totally does.
Smoking ruins everything.
Absolutely. The answer is false.
You
had your card backwards.
Yeah.
You knew,
I meant false.
Sorry,
Yeah,
I'm getting the point for that.
Come on, Dr. Gold. You got to give me half a point. Come on.
yeah, you just had. You
I
knew
just
the
spun
answer.
it the wrong way. That's
yeah.
all.
It doesn't matter, my friend.
In cigarette smoke, there's cyanide gas, just
Okay.
like what they use in the gas chamber, and it destabilizes the tear film, causes dry eye. Next question. It's okay to sleep in your contact lenses if they're extended wear.
Oh, it's such a bad feeling.
Horrible to sleep in
So
your contact
annoying.
That's what I've
lenses.
heard. I've never worn them, but I've heard it's
Even
really
though
bad.
they're approved by, some brands are approved by the FDA for sleep, the infection rate is absolutely unacceptable. It's very, very high. So please don't sleep in your contact lenses.
What does somebody do? Say they sleep in their contact lenses and then they wake up and their eyes are all bent out of shape.
You gotta try and peel them out. It's awful.
You got to lubricate and take them out. There's a young woman in, I think, Thailand who is going to be blind for the rest of her life from sleeping in her contact lenses, and amoebas attacked her eyes.
Oh my goodness.
Amoebas exist in tap water, so never do tap water to clean your contact lenses.
Okay.
Next question. LASIK is the newest laser vision correction option.
No, we have epi-lasik, don't we?
Epi-lasik.
Ah, look at that. You got that one right, Teresa.
I want to show your viewers the difference between LASIK and epi-lasik.
Okay.
In LASIK, a flap is cut in the cornea. The laser vision correction happens here, and then the flap comes back down and seals overnight. But where the two meet, there's never full healing. So for the rest of their lives, people who have had LASIK are subject, if they get hit in the eye just the wrong way and the flap comes loose, they've got 1 hour to find somebody to fix it, or they're going to need a corneal transplant.
Oh my gosh.
Wow.
So at Liberty Vision, over the last 4 years, I have not done any more LASIK. I'm only doing epi-lasik, which is the procedure in which the surface cells are removed by a device that's similar to a snowplow on your driveway. The laser changes the shape of the next layer down, and then when those cells grow back, they conform to the new shape, and the vision change has occurred. It's immensely safer than LASIK because there's no cutting involved and no flap.
And it's a painless procedure. You don't feel it.
That's right, and that was going to be my next question.
Oh,
you already
I
got it.
didn't
You
know.
already got it right. Laser vision correction is painful. True or false?
Oh,
The
false.
pain at all.
procedure is not supposed to give any pain either during or after the procedure. Patients will feel some pressure on the eye for about 20 seconds, and then to prevent postoperative pain, I chill the surface of the eye, and they can get a little brain freeze for about 30 seconds. Otherwise, no pain.
That's not so bad, right?
Yeah, it's
to be able to
pretty
see
quick
again
in and
without
out
contacts.
And then during the postoperative period, which starts about 2 hours after the surgery, they go home and go to sleep for 2 hours, get up and do normal activities. And during that entire time, there may be a little burning, a little tearing, but no actual pain. And people are taught in my practice how to deal with that. The other thing that makes my practice different than other people's practices, aside from not doing LASIK, is when people come to see me, they see me. I have one assistant who does one of the scans because she's better at it than I am. But everything else, pre-op, surgery, and post-op, I do.
Great.
And we were recently rewarded by that by winning first place in the Advocate Readers Poll
Oh,
for
congrats.
best place of
Fantastic.
LASIK.
And then you have a special offer for our viewers?
We do.
We have to mention?
Anybody who calls in and mentions this program receives a $200 per eye discount from their surgery. And we've also extended that offer to first responders and active and retired military.
How generous
very
of you.
nice.
That's fantastic.
good.
Dr. Gold, thanks so much. Thanks for playing along with us
Right.
also.
It was fun.
All right, and now to an inspirational story. A young pole vaulter making great leaps despite what most would consider a huge disability.
Yeah, but Charlotte